Good evening, everybody, and welcome to our Baby Bunting live series. This is episode 18. I'm Elise, and with me tonight I've got Dr. Brooke Harcourt. Now, Dr. Brooke's come to talk to us about nutrition for mum and bub. Now, if anybody would have any questions throughout the session, please jump onto our Facebook Live section, and in the comments just pop your questions so that we can answer them at the end of the session. So, Brooke, I guess how did you come to get into the field of nutrition for mum and bubs?
Yeah, so hello everyone, thanks for joining us. Baby and mum nutrition was my second career. It was something that I started midway through my 30s. I decided that there was something more I could offer in preventing chronic diseases that I'd been researching for the start of my life. And it was an area that I fell into, wanting to change the perspective outcome by helping mums and bubs reach nutritional adequacy.
And I think that's wonderful, your expertise. You've come into this, I guess, area where it is so overwhelming and can be so confusing for people.
Yeah.
And I've got a few questions that I'd like to ask you
Great.
throughout this session, just to be able to help our audience, I guess, navigate their way through.
Yeah, perfect.
So what are some of the best cures for morning sickness?
All right, starting off hairy.
Starting it off.
So perhaps preventions and cures are best addressed if we know what the causes are. So morning sickness, we don't really know why it's there, but there are many theories. We know that it most often occurs when there's a drop in blood glucose levels. So if we try and maintain blood glucose levels throughout the day, then we're less likely to have nausea. It can occur at any time of the day as well, so a bit of a misnomer there, being just morning sickness, and it doesn't just stop at 16 weeks for everyone as well, so it can continue for the whole pregnancy. So that old wives' tale that your mum or grandma might have given you of keep those crackers by your bedside actually has some validity in what it does. So if you have something small to eat before you get up in the morning, you've evened out your blood glucose that was dropped because you'd been fasting, and you're less likely then to get to feel nauseous. Staying hydrated will also prevent nausea occurring, and if you become hydrated, using those rehydration drinks and things can prevent nausea persisting. There are other, ways of preventing, which have been shown in some clinical studies. One of those is a high vitamin B6 you can have, or ginger root tea has also been shown to prevent nausea for some women as well.
Okay, so I guess a lot of the mums out there would be thinking about what supplements they can take and what happens if they can't take their supplements.
Yeah, so around 30% of the population can't swallow a tablet. So when you're pregnant and faced with that once or twice a day, depending on which brands you've taken, can be quite daunting. Other women find that the complications, whether they're gastrointestinal and that they feel from taking those supplements as well, are a little bit overwhelming and choose to stop them. But supplements are very important because they contain things that we just can't get from eating adequately throughout the day. So no matter how good your diet is, no matter how much you concentrate on those different types of foods that you have, it's often physically impossible to get the level of some of those nutrients that you need. So those vitamins are important for the entire pregnancy as well. So really important things happen at different stages along the way. For example, in the last 4 to 5 weeks of pregnancy, all of the iron crosses the placenta from the mother across to the baby, and that's where they have their stores for the entire first 6 months of life. So if your iron levels are not kept adequate, then inadequate amounts of iron will cross across the placenta for your baby with the potential for iron deficiency.
Okay, so it's things like that which I guess we don't know.
Yeah, so a lot of women, have that iron reading or that test that they do, and it says that, oh, my iron levels are good, and they think that means that I don't need to take my supplements anymore. But that's a really important time for baby that you continue to take them during that time as well.
Okay, and I guess throughout our pregnancy there are some things which can be uncomfortable, and I guess it's things like constipation.
Yeah.
You know, how can I try and, I guess, cure my constipation while I'm pregnant?
Yes. So constipation can be caused by our supplements and the type of iron that's in there, which is possible to be addressed because there's some more clever products on the market now, and we're able to still get that iron that we require, but maybe it needs to be in a different form for your body to absorb. But constipation is, I guess, a byproduct of everything that's going on in your body too. So our body wants to maximise the amount of nutrition that it gets, and therefore it slows down. So the stomach slows down on how it passes food through to the gastrointestinal tract, and the gastrointestinal tract slows down as it moves the masses through as well. And that's so that maximum absorption of everything that you ate crosses across. But it also means that maximum amount of water crosses out too, and that means you can get a harder mass. So one really good way of fixing constipation, therefore, is to drink more water, to soften that mass by adding to it. The other way is to increase our fibre intake. So fibre, a lot of people think, oh, I must be having too much fibre because I'm constipated. But in actual fact, it helps retain water throughout the mass. So increasing our fibre in our diet means that those masses retain water on the inside and therefore don't get really dry by taking it out when it moves along slowly. And the other way we can do it is by going for a walk. So some exercise gets our gastrointestinal system working as well. So, but there's no, I guess there's some other things that if you are suffering and it's stopping how you're eating, go and see your doctor, go and see your dietitian. You don't have to suffer through these stages. There are some other things we can look at doing too. If it's stopping you eating or stopping you being active, definitely go and see someone for that.
Yeah, because it is quite uncomfortable.
Yes.
You know, so you do want that assistance from a medical practitioner.
Yeah, definitely. Yes.
And I guess as we've spoken about what you're eating, you know, it's passing, the nutrients are going to the child.
Mm-hmm.
Do the babies taste everything in the womb?
Yeah, so there's been some really interesting studies that I guess not necessarily people tasting amniotic fluids, but testing amniotic fluids at different stages and looking at the different chemical makeups of that. And show that, I guess the flavour and the flavonoids that are present within amniotic fluid change depending on what the mum has had. So if you look on ultrasounds, you'll see baby with their little mouth open, swimming around in there. They're tasting everything, and that's getting their gastrointestinal system ready. But they're also being exposed to everything mum's eating. So thinking about what we're putting in, that baby's eating that while they're growing along as well.
Okay, well that's quite... I hadn't ever thought of that before when I thought they were just smiling at us.
No, so they're constantly, taking bits in.
And I guess that now, you know, as we start to go through pregnancy, we're often using Google to try and find out information, especially things like gestational diabetes. Yeah. You know, that's a really big thing. Is it something that, you know, mothers can, I guess, prevent?
Yeah.
What is your direction for that to try and assist them have the knowledge?
Yeah, so I'll just caveat this answer with, designed for a general population and not designed to precede anything that your healthcare professional may have given you previously. But in a general sense, we can work towards, levelling out our insulin secretion so we don't get to the point where it's insufficient both for ourselves and for baby. So mum's insulin supply is working for two beings. And the way that we even that out and therefore hopefully prevent that stress that may occur is to eat lots of low GI foods. So they're those slow release glycemic index foods. So it might be multigrain breads, it might be fruits and veggies with the skin on, so they're releasing slowly, seeds and nuts and things, lots of slow release glycemic things. Keeping up our exercise is also a really good way to have a healthy weight gain during pregnancy as well, and just monitoring what we think that healthy weight gain should be for yourself. But if you do get gestational diabetes, it's not your fault, and it's something that for a lot of women does occur, and there are ways of us helping and you through managing that, but there's no reason for you to feel ashamed that if that's something that's happened for you. There is a genetic proponent to gestational diabetes as well, and we know that some women are probably more predisposed to them having that.
So I guess now that I've given birth to my little one, should I keep having my supplements, you know, after the birth of the little one? Is that something that I should continue with?
Yeah, so our supplements, so there are both taking the ones that you've probably got half a box of left is really important, but there are also some post-pregnancy ones as well. So if you think of, for some women, that traumatic experience of birth on your body, and the amount of nutrients that it uses in that instance, whether you've had excessive bleeding or whether you've not eaten for a while, depending on how your labour's gone, you're in a state of recovery. Your body needs that support for that stage, and for a period of time, your body still thinks it's pregnant too. So it helps with the recovery period, getting your iron levels high, and can even help with the initial stages of breastfeeding if we make sure that we have all of the nutrients there to support baby.
So are there some specific foods that I should be eating while I'm breastfeeding?
Yeah, so if we think of, I guess, the best nutrient foods that work the fastest in our body, they're carbohydrates. So mums are quite often surprised when I tell them they need to be eating the equivalent of 8.5 slices of bread per day to get enough carbohydrates. So if we think of carbohydrates as making milk, then we need to be eating those consistently. So carbs with every meal works. We need to be having enough protein. We need to be having enough water throughout the day as well. So if we think that we're making liquid, we need to be making sure we're rehydrating too.
So with that, are there any foods which could boost my milk supply?
There's some research that shows us that some things like fenugreek will boost our supply. Some different carbohydrate containing foods will as well, but making sure that we're getting enough nutrients as well too. So poor iron can be associated with a low breast milk supply. So making sure we're getting enough of all the good meats and nuts, or vegetarian. If we're vegetarian, then beans and things as well. All of that will help us in that process.
So with still on the breastfeeding, are there any foods that I should avoid while I'm breastfeeding?
Yeah, so I guess some women have complications, or the baby feels complications with some, I guess, windy style vegetables. So if we think of cruciferous vegetables, so those broccoli, kale, those really dark green ones, not necessarily need to avoid, but can cause your baby to be a little bit more windy in those instances. So limiting those. There's some information around limiting things such as large flavonoids, such as onion and garlic containing foods, that they may affect the baby as well. But I don't normally advise that we need to avoid them. We just limit our intake of those sorts of things. But soft cheeses become back on the cards. We should still stick to our fish guidelines. So that being 150 grams a week if it's a large fish. So a fish that eats fish, we still need to limit those. But otherwise, no, there's nothing we really need to avoid anymore.
Okay. And I guess, can a dietitian help me choose a baby formula? I guess it's your knowledge and your experience.
Yes.
Is that something that I could come to you with to ask for that guidance and assistance?
Yeah. So if you get to the stage that you would like to start feeding your baby formula, a lot of women come to that. It's a struggle that time, and it's a struggle that people often don't seek help for, but they're welcome to. Dietitians are trained in this area. We understand what that large wall of formula means. We understand the different things that are going on in all of the different containers, and understand the different additives and all those labels. And so, yes, I guess we are a really good source at that time for you, just helping you choose what might be best financially going forward, or different conditions that your baby may present with. We can help you through that stage, definitely.
So will you
decipher the code.
Yeah. And I think that's a big thing. It is such an emotional time in your life, to whether you go breastfeeding or bottle feeding. So will you also assist with, say, choosing bottles, which are best going to help that little one as well?
Yeah, we can help you, I guess, test out some different ones. We often have things that we can help you with. We can help you troubleshoot sizes if it's not working for you, or troubleshoot holds in some instances too. We trained to help you do that as well. If that's the path you have gone down, or if you're co-feeding as well, we can help you work out a bottle and co-feeding schedule so that you can maintain breastfeeding too.
Okay, so it's really, you're there to assist and to help and to give that guidance.
Yeah, and if a mum felt that they had low supply too, we might be able to help them boost that in that instance. instance as well by looking at their diet and feeding schedule and feeding pattern as well.
And I guess for those little ones which may be tongue-tied, or, are you able to assist with that feeding as well?
So we don't assess tongue ties.
Yeah.
Lactation consultants can help you. So some of us are duly qualified and can help you assess a tongue tie and direct you to where that may help you. And I guess it's still, there's two sides of the coin as to whether we repair them or not, and what's right for your family. So we look at all of the options in that instance, what sort of recovery you might have to expect, chances of recurrence, whether it is actually affecting feeding in some instances too, or whether your baby has developed an adaptation so that they're not influenced or affected by what's happening for them physiologically.
Okay. And I guess with the little ones we're doing feeding, so I guess also on the other end is how often should I expect my little one to do a poo?
Yeah. Okay. Yes. So yes, poos. I am text message lots of dirty nappies. It's quite funny if someone picks up my phone. It might potentially be a photo of a dirty nappy coming through for me to decipher what's going on. It's like tea leaves. Pooey nappies. But it's something that really worries parents. It's something that I guess once you become a parent, you talk about when did my baby last poo, or what poo schedule are they on, or not wanting to leave the house if they're a baby that doesn't poo very regularly. So it's normal for babies to poo between multiple times per day or once every 10 days. So it might be a bit too much information, but I was a baby that pooed once every 2 weeks. So my mum had it made. I was a unicorn baby. Might have only had to change 26 dirty nappies a year. It's amazing. But yeah, it's depends on your child, and it depends on how it's affecting them. But it is, and again, it's normal for that to change as well. It'll change depending on whether you're changing over feeding methods. It'll change when you're introducing solids. It's how it's affecting them, and whether it's affecting their development or their feeding and things as well. But yeah, it might be multiple times a day, or it might be once every 2 weeks. But if your baby went from pooing every day to not pooing for 7 days, that might be a really good time to have someone help you out there and just have an assessment of whether they've been feeding and things as well. But your wet nappies is also a really good indicator of how their baby's doing.
Okay. So as you've said, I guess doing that change of what they're eating. So when should I now be introducing solids?
Yeah, so Australian guidelines, so NHMRC says at around 6 months and not before 4 months and before 7 months. So that's a pretty big gap for a lot of parents, and I guess especially at the moment, a lot of worried parents because they've not been having the support network behind them. No one else is around for them to get that double check on what their baby's doing, and it's I guess it has been a really troubling time, and I think all parents that have got to this stage through isolation have been really amazing. But we have to assess if your baby's ready. And that's what it's based on. So a baby will show interest in feeding. They might start mouthing and opening and shutting their mouth when you yourself are eating at around 6 months. They might start doing this at about 5.5 months. I always tell parents to not get overexcited when baby starts showing readiness signs and think you need to go to the shop and buy all sorts of things. Just start slowly, and it's like any other activity that we do. We learn best if we watch it for a little while first. So not the first day that they start showing signs, maybe leave them going for a week and then start to introduce those solids, but slowly. So it might be a whole tablespoon that they eat for their first 4 days, and just that really slow introduction, ramping up to 1 or 2 meals, and then probably to 3 meals by around 8 months.
Okay, so what sort of things should I start to introduce first?
So high iron containing foods, because if you think that we spoke that all of the iron is crossing the placenta for about that first 6 months, and that's the reason that we ask parents to start with iron containing foods. So they're those fortified cereals that you get that contain iron. They are beans and legumes. They are meat broths or dishes that have had meat pureed into them. So baby needs to be replacing that iron needs that they need for growing to maintain their growth, which is very rapid in those 6 months that they're coming up to. Other than that, nothing's off the table except for your no foods. So as long as everything is an appropriate texture for the baby, then they can have anything. And sooner that families are able to transition their babies to those family style foods, the better off they'll be.
So is that the baby-led weaning and the pureed foods is when you're saying that's what we should be bringing in to that little one?
Yeah, so I guess baby-led weaning and the baby-led weaning camp versus the puree camp, I find parents often pre-decide which way they're going to wean their children before their child's at that stage. And I advise against that because we don't know what your child's going to be able to handle in terms of those textures. So baby-led weaning is I guess, a notion that they will have whatever is around in the house. But some parents take this as it means no spoons and it means no purees and it means no wet foods and things at all. That's not what it means. It should be an incorporation of those textures as well so that we can transition your child through those, and offering those spoon foods as well as finger foods at the same time means that they'll get a mix of those textures. They'll be able to sit and eat a food that is high energy or densely nutritious because it goes on a spoon at the same time as they struggle or learn through that more difficult handheld or solid texture.
Okay, so
but purees so definitely needs to be an element in there. But transitioning through that puree grade, so lumpy and mixed texture and challenging your baby with that, probably before you would think that they need to, or just at least trying them on those different textures along the way at the same time.
And is that a big thing for development as well, to have those different textures in their mouth as they're, I guess, transitioning?
Yeah, so starting on solid foods and transitioning through those textures helps to shape the palate. So babies that miss out on having those harder texture foods that they need and finger foods miss out on that flattening, using their tongue to flatten those foods against the top of their mouth. So a baby can, tongue to palate, can handle something you can squish between your fingers. So that's quite significant what they're able to handle. And that motion and in their mouth helps to shape their language skills going forward as well.
Okay, so it's a big thing. I guess it's something you don't think the impact of what's going to carry on.
Yeah, so I guess eating is involved in lots of stages of development. So those finger foods help with your pincer, they help with grasp, grip, so there's that element involved as well. Helps with body awareness, so teaching them how to use a spoon teaches them that really important distance of that spoon and food and distance between their mouth. So that's an important step for them to be developing too.
So I guess one thing which is, I guess, a little bit more is, what if I want to have my child being a vegan or a vegetarian at that point?
Yeah.
What should I incorporate into their diet?
Yeah. I see a lot of families for this reason, and I guess it's becoming a much more popular style of feeding our babies in our culture, and that's great. And the position of the World Health Organization and the NHMRC and the Australian Dietetics Association is that it's possible to be healthy at any life stage on a vegan or vegetarian diet, but it does require extra planning. It needs to have sufficient amount of iron that your baby or toddler can process at those stages, and that iron will come from those difficult textured foods, including legumes and pulses, so beans and things, which if you think have a difficult texture to initially process, but they also need to be able to eat sufficient amount of them to support their growth. You also need to look at some of the other supplements they might need that you can't get from non-animal products, such as vitamin B12. So just that planning needs to be in there for that.
And I guess with that, can you really prevent fussy eaters? You know, our little ones, they'll sit there, no, don't like it, no, don't like it.
Yeah.
And we're not really a kiosk at home to have different meals.
No. Lots of mums are short order cooks though. I do hear very many stories of, they didn't eat that and they didn't like it, so I got up and got something else, and I got up and got this one. babies don't start out fussy. They, I guess that screwy face is often mistaken as they didn't like a food, where it might have actually been that it was different, and that was their way of processing those different sensory elements that were going on at the start. So persisting with something that you initially thought they might not have liked might just be their way of processing. But research tells us that offering multiple different things at a time, so if you have multiple different vegetables, leaving them in their single forms instead of making a big grey-brown mush when we make that puree, will mean that they start to learn that things come in different textures, things come in different flavours a lot earlier. We know that mums that have a varied diet during pregnancy are less likely to have fussy eaters later on, which is quite interesting and a really good reason to eat well during pregnancy as well. But yes, offering and re-offering multiple things. Introducing a new food alongside a preferred food can sometimes also work, because they're able to tackle that preferred food whilst contemplating that new food, but also modelling. So babies learn to eat from adults, so we need to be modelling that we're eating these foods that we're giving to them as well.
And I think that's a big thing. You know, those little ones will sit there.
Yes.
And if you push the food that you don't like to the
Yes.
side, they're like, well, Mummy doesn't need it, Daddy doesn't need it.
Yes.
I won't touch that
Yes.
one either.
Why am I being given this food that we as a family do not eat? And it's that attention that they really pay to what part they play in your family unit.
So I guess some little children will often say, oh, my baby's lazy and doesn't like to chew.
Mm-hmm.
So it's easier, I just keep doing my puree. So
Yeah.
are there any little hints and tips that we can give our audience out there?
Yeah, well, babies will gravitate to what's easiest. They don't, especially if I've dinnered late and things, they'll gravitate to what gives them the energy, like the easier form. So that's where purees and spoon foods and things are quite often easier to have. I wouldn't say babies are lazy. Maybe that they don't have the skill yet to tackle those foods. So maybe we need to model and show them what happens in our mouth. Maybe we need to let them know that this might need more chewing than we're used to. So children will gravitate to those foods that are consistently the same. So quintessential child food is chicken nuggets. The chicken nugget we had yesterday, the chicken nugget we have today, and the chicken nugget we'll eat tomorrow is exactly the same texture. It's eaten in exactly the same way. We have just as many bites, I chew it 10 times and then I swallow it. They don't have to think about it. So it's not necessarily that that's going to always be their preference food, it's that they know the process to eating that food. And therefore as parents, our role is to teach them the process for eating all of these different foods, even if that's explaining that it'll be a different process, and that's okay too. So carrots change throughout the throughout the bag of carrots that you buy, they'll all be different, and just teaching them that's a natural part of learning to eat.
So I guess some of the things we'll often see as a parent, my child doesn't like vegetables. So we then remove the vegetables.
Yes.
What advice can we give out there to I guess to be able to work with that? Because you've said about nutrition and in a well-balanced diet, including our vegetables.
Yes.
Which even as adults, many of us will sort of skip.
Yes. Yeah, so vegetables are really tricky to learn how to eat. They do change all the time, but they're also quite bitter in lots of cases too. So I think it's okay for parents to change the flavour of vegetables so they can learn about the texture of them, and we can gradually change the flavour back to what it is later. Seeing them in different forms can help boost confidence too, so don't be afraid to throw that spinach in your smoothie. Having carrot in your banana muffins as well, letting them have confidence that they've eaten these foods in a different form. If they're going to see broccoli and carrots exactly the same on their tray all the time, they've been ignoring them, they kind of get a little bit of blinkery to those, so mix it up. Shred them, grate them, put them in a different form to what they're seeing normally. Get them involved in the kitchen if they're older and toddlers, in unpacking them into the crisper or something as well. They need exposure on a number of different levels. It's quite normal for a child though to see and be exposed to a food 15 times before it will be incorporated regularly into the diet.
And I guess you've just started, now we're moving to that next stage, that toddler nutrition. So what does my toddler need? In a perfect diet, if we could, what would be the best for them?
Yeah, variety. Family foods, so whatever your house eats, really, they need to be part of the family. They need to be sitting at the table. Really important for toddlers to learn foods about the social aspects as well, to be able to sit straight at a table and learn from watching someone eat those foods. They don't need as much milk when we get to that stage, so food should be their primary source of nutrition, no longer that milk that they might have otherwise been having, so decreasing that in some instances if we find that they're a little bit extra fussy or turning away from their solid foods.
So we're going to see if there are any questions out there from our audience tonight. Nat, have any questions come through?
Yeah, so Sarah on Instagram has asked for the best foods that you would recommend to eat during pregnancy and things that she should steer clear of.
So things we're steering clear of in pregnancy are our salads and our deli meats, that so salads that we haven't made ourselves, so we haven't pre-washed. So thinking of our bacteria that we want to avoid, so our Listeria, our E. coli and our Salmonella, so those high risk foods we should be avoiding. So pasteurisation does not kill those bacteria, so we need to be avoiding things like so soft cheeses, even if they've used pasteurised milks, so avoiding those food safety elements. And best foods to eat during pregnancy, so so those low GI carbohydrates are going to support your energy overall, so we need to have a constant supply of those. Spreading your protein intake out over the course of the day is a great way to make sure we're getting that in. If you're having trouble keeping food down, small meals regularly will help you meet those nutritional requirements as well.
Navidika has asked if it's okay to give her newborn both breast milk and formula.
Yes, it is. Yes, it's possible that if you're moving towards wanting to increase have bottle feeding or co-feeding, it's possible to have both, and your baby will still have the benefits of you continuing to breastfeed as well. So any breastfeeding that continues is optimal for your child. If you need to do both, that's fine too.
So Brooke, I wanted to thank you for coming tonight to be with us at Baby Bunting, but is there any final bit of information or advice that you can give our audience out there, just I guess on nutrition for mums and bubs? Or
Variety. So the more different types of plants and fruits and vegetables and meats that we see over the course of the week means that baby sees all of those too. So eating the rainbow has its benefits because we're getting all the different vitamins and minerals from all those different fruits and veggies, and variety I think is the best.
So thank you, and I guess everybody out there are people out there to help you, such as Brooke.
Don't do it yourself.
It is a very challenging time, and especially now, as you are, a lot of people have been in isolation and need that bit of support or that bit of guidance, whether it be for themselves while they're pregnant or once they've had their little one or for their new baby or their toddler. So please reach out and ask for that help. Everybody's here to help you get through this, this time in your life. So we thank you so much for joining us tonight, and we wish you all the best, and we'll see you again in our next live series. Thank you and goodbye.